So let's go through a few exercises that you can implement right in your own home without any equipment so that you can not only help eliminate some of your back pain, but increase your core strength and help you live a healthier, happier life. Let's get into it. The first exercise we're going to do is the standing hip abduction. This exercise can be done with or without resistance bands around your feet or your ankles, depending on if you have them at home. If you don't, great. This is going to help with contraction, help with body awareness, help with balance, and get you started on something pretty quickly. So let's go through it. So what we're going to do, we're going to want to stand close to something, especially if you have balance issues. So if we have a counter, a support surface, a wall, whatever you have next to you, we're going to use that first. So we're going to stand on that one foot. It doesn't matter which foot we stand on because we're going to do both sides. And from here, what we're going to do is just kick that leg out and back a little bit. So if we're a clock and we're standing in the center of a clock, and this is 12 o'clock, 6 o'clock is directly behind me, 3 and 9 are out to the sides. I'm kicking out to 7:30. We're going to kick out nice and gentle, nice and slow. We don't have to do too much. If we do too much, that's going to cause us to have a little bit too much of our back getting involved. If we're feeling like this is getting our back involved, we're doing too much. We got to go and shorten up that range of motion a little bit. So basically how that should look like, if I tighten up my shirt over here, is to just kick back and out to the side, nice and small. Nice, get that nice butt contraction, and we're going to feel that on the side we're kicking and also on the leg that we're standing on, just to give us a little bit more of that double activation. If we're using a resistance band around our ankles, around our feet, that is going to give us a little bit more activation. It's going to require a little bit more strength, but at the same time, it's going to really help us get a better workout and get a better benefit out of it. The second exercise we're going to do is the primal hold. Now the primal hold, we're going to be getting onto the floor. And the purpose of this exercise is to really get the activation of our core going and also help integrate that with what's going on with our shoulders and with our hips. So we're going to get on our hands and knees. If we have knees that are not necessarily the best, we want to put a pillow under our knees so we have a little bit better support. And what we're going to do from here is we're going to push up our knees off the floor. Before we lift our knees off the floor, we're going to take our abdominals. We're going to try and bring your belly button in towards your spine, hold your stomach nice and tight while still being able to breathe. That's very important to do. And from here, what we're going to do is just going to lift those knees up off the ground, and we're just going to sit here and hang out. We're going to hold for a bit. We can hold for 10 seconds, 15 seconds, 20, 30, a minute. Basically, whatever you feel like you can tolerate in this position is where we're going to start. And from here, what you can do is you can build up the amount of endurance you're able to tolerate. And from here, you get a nice, strong activation. We get not only the abdominals working, but we get the smaller stabilizers and rotators in our spine working as well to help with the rotation of that spine and help you get into a better position and performance. The next exercise we're going to do is something that's very integral in any kind of bending and lifting activity that we may need to get to in the future is a hip hinge. Now we can do this in a number of ways, and then we're going to do this very specifically right now. If you're somebody who's struggling with this because you're dealing with too much pain, I'm going to show you a different variation of this just to make it a little bit easier for you. So what we're going to do first, we're going to hold those abdominals nice and tight, belly button sunk in towards your low back. We're going to make sure we're still breathing nice and gradual and slow. And from here, what we're going to do is put our hands on our thighs. The first movement is going to be our butt is going to come back, and we're going to allow our hands to slide down our thighs. As our hands slide down our thighs, our knees are bending just slightly. Our butt is continuing to go back to the wall behind us, and we're going to keep going as far as we can until we start to get a little bit of achiness. If we start getting a little bit of achiness, we're going to stand right back up. If we continue to feel good, if we continue to feel like there's no pain, there's a little bit of tightness maybe, but not necessarily any of that pain that we've been experiencing, we're going to keep going down all throughout that range until we feel a pretty good stretch in our hamstrings, or we feel like we start losing our spine neutrality, where we start to get a little bit of that forward curve in our spine. If we get that, then we want to stand right back up. This is something I recommend you perform in the mirror to the side like I'm doing right now in this video, because what I want you to pay attention to is because some of us may not have that ability to detect where our spine is in space. And if we can't detect where our spine is in space, we need another cue, which is our vision. So if we're standing in that mirror with it facing out towards the side, we can see and pay attention to what's going on with our spine, making sure we're not arching too much, make sure we're not rounding over too much. So we have the ability to determine where we are in space, get better understanding of our body, and get a long-lasting solution to getting some of this pain to go away. The last exercise we're going to do is a resisted march. Now, a resisted march is going to be something that helps with our balance, our stability, our core activation, and also helps with rhythmic and alternating movement from side to side with the body. Now, this exercise is going to be something that is very simple. You can do it without a resistance band. A resistance band, just like with the standing hip abduction exercise, is going to make this a little bit better and more effective. But if you don't have it, it's okay to do it without. So what we're going to do, again, up nice and tall, core tight, and from here we're just going to come up, maintain that march position, put your foot down, maintain and stabilize, and we're going to go back and forth. Well, we want to do it in front of a mirror if you want. We want to make sure that our hips are staying nice and level, because sometimes if we don't have appropriate hip control, what we can do is we can just drop that hip out and still do this exercise. It won't be as effective. We may notice that we have more balance control issues, but we want to make sure that that pelvis stays nice and level as we go back and forth. You can do that by, again, like I mentioned, standing in the mirror or standing with our hands on our hips to make sure that we're not dropping out to the side. And also, we want to make sure that we are getting good activation in the sides of our hips. As long as we're feeling that, we're doing great. We feel like we're getting good activation. We're getting alternating activation between this low back exercise, these low back muscles on the outside here and the hip muscles on this side. And then when we go on the other side, we're getting outside hip muscles and outside low back muscles as well working. Again, using that resistance band around our feet, around our ankles, will make this a lot more significant, will give you a better challenge, and give you a better lasting result. So that's it for today's video. If you enjoyed this video, make sure you like it, comment anything that you took away from this video, mention things that you've tried, ask any questions that you specifically have about issues that you're dealing with your low back, and also make sure you subscribe to our channels, both on Facebook, Instagram, TikTok, and here on YouTube. I hope to see you in the next video where we'll talk more about low back pain and give you some more solutions to it. See you guys in the next one.